Today, Maine's Department of Health and Human Services released the findings of an independent review of its child welfare system.
The state's Office of Child and Family Services faced intense scrutiny after 5 children died in June of this year alone. Good evening and thank you for joining us on News Center Maine at 5:30. I'm Amanda Hill.
And I'm Chris Costa. The state hired an outside organization to dig through the details and see what needed to be fixed. This is what it found. The report lists 7 key findings: the COVID-19 pandemic, turnover of staff, time frame constraints, standby staffing patterns, communication and coordination with providers, difficulty engaging with caregivers, family team meeting coordination, and communication between partners, law enforcement, and hospitals. COVID-19 forced staff to quarantine, shifting their work onto others. Staffing was already short, making that problem worse. And turnover also led to high workloads, as new staff had to take on more cases from those who left. That's cyclical. Those overwhelming workloads led to more people leaving, and the process snowballed. That meant staff did not meet important expectations, like contacting children and families, and only focusing on the highest risk or more manageable cases. The report found supervisors struggled to support their staff. Another issue? Time. Staff said cases had to be assessed within 35 days. Staff told investigators that these days, the amount of work they're expected to complete in cases has gradually increased over time, without adjustments to that 35-day time frame. Staff said that made them feel that they don't have the time they need to complete all their tasks or have a meaningful impact with the families they support. Plus, there are standby shifts, essentially after-hours on-call work. The report says staff were assigned to the cases without much attention to their level of experience or the severity of the cases, and that staff were unfamiliar with each other. This led to issues falling through the cracks. Communication was a big problem too. The report found healthcare workers who were helping parents with mental health or substance abuse problems were less likely to coordinate with child welfare staff. That means families did not get help in a holistic way. Many families also did not want to interact with the caseworkers. Families are not forced to meet with caseworkers unless a court order is involved, leading some caseworkers to feel hopeless when working with resistant families.
229, go ahead.
Another communication problem is between law enforcement and hospitals. The report found hospital staff are less likely to share information with officers due to fear of Hipaa violations, leading to only vague information for officers to pass on to caseworkers. So that report also lists several recommendations for the Office of Child and Family Services, like working with a team of providers to support better coordination, establishing joint protocol agreements between law enforcement, hospitals, and child welfare staff when there is suspected abuse or neglect. Also, recommending OCFS to make roles more clear and consistent, and looking at national best practices around those standby or after-hours practices and the assessment timeframes. They also recommended the Office of Child and Family Services to remove unnecessary or redundant tasks. We reached out to DHHS for a comment, but a spokesperson said no one was available for an interview today. In a statement, Child and Family Services Director Dr. Todd Landry wrote, "KC's expert review will help us work with our partners throughout the child welfare system to keep children safe and support Maine families now and into the future." Commissioner Jean Lambrou wrote, "We are comprehensively evaluating their recommendations to identify steps we can take immediately and over the long term to protect Maine children." We also reached out to Senator Bill Diamond, who's been leading the charge in the legislature to overhaul the child welfare program. He's in Nashville right now and had this to say about the report.
I just want to say I'm not totally negative about their report. I think it's a good step. These recommendations, if they are completed, followed through, I think it'll improve the system. I just don't think they got into the hardcore problems that address this, that are in this department, which I wish they had.
You can read the full report on our website or app.